Intermittent fasting, commonly known as IF, is a dietary approach that involves interspacing planned periods of fasting with regular eating. It has recently become a health trend and popular to lose weight, improve metabolic health, and perhaps even extends your lifespan. What is intermittent fasting? IF is a diet regime that involves a cyclic pattern of unrestricted eating and fasting, like no food at all or considerable calorie reduction at brief intervals and involving limiting food intake into 4 to 6 hours and extends the overnight fast from 12 to 18 or 20 hours. Studies about IF have shown that it helps in significant weight loss, improved fasting blood glucose levels, more tolerance, and no hypoglycemia. Hence, it has been recommended as a beneficial additional dietary strategy for type 2 diabetes management. So, what are the 6 types that intermittent fasting can be done? Number 1, 16:8 diet. This 16 by 8 method involves daily fast of 14 to 16 hours and limits your eating window to 8 to 10 hours. Within this time, you can consume 2 to 3 meals as per preference. For example, if you eat your dinner at 8 p.m. and fast till noon the next day, your fasting window would be 16 hours. Number 2, 5:2 diet. It involves eating 500 to 600 calories for 2 days out of a week and eating normally the other 5 days. For example, you eat regular meals every day except Tuesday and Friday. On your fast days, you eat small meals twice a day and keep your calorie intake limited to 500 to 600. Number 3, eat, stop, eat. Has 1 or 2 24 hours fast once or twice a week. For example, if you have or eat your meal at 8 p.m. on Monday and fast until your next meal at 8 p.m. on Tuesday, you have completed your fast for 24 hours. Number 4, alternate day fasting. Fast every other day, either by not eating anything or only eating a few hundred calories. For example, you ate your last meal at 7 p.m. on Monday, did fast or limited calorie intake on Tuesday, and again ate on Wednesday. Number 5, the warrior diet. You eat small portions or quantities of raw veggies and fruits all day, followed by a large dinner at night. So here are some important points to remember if you have diabetes and want to try IF. Number 1, get in touch with your doctor if you are adopting an IF diet plan. Even if you can do it, stick to what your doctor recommends to you with food and medications. Make sure you eat a balanced diet during your fasting and non-fasting windows. Include food items of all food groups. Number 3, avoid eating more than enough during your eating window or non-fasting window. Number 4, include food items that have a low glycemic index because these get absorbed slowly. Number 5, make sure to eat fruits, vegetables, and fresh salads during your fast window. These make you feel full while maintaining your blood glucose level. Number 6, most important, when you break the fast, avoid fried, fatty, sugary food products. Try baked, boiled, and grilled items instead. Number 7, drink plenty of water. Number 8, do not forget to check your blood sugar levels frequently. Number 9, if you see any sign of hypoglycemia, break your fast as soon as possible and get back to your usual diet. IF shouldn't be done by number 1, women who are pregnant or trying to become pregnant. It's because extended fasting periods may throw off your menstrual cycle. Number 2, those taking diabetes medication. It's because blood sugar can drop too far in the absence of food. Number 3, anyone on multiple drugs. It's because food or lack of it can affect the absorption and the dosage. The bottom line: medical guidelines on how to manage therapeutic intermittent fasting in people with diabetes are far and few. However, when done under the supervision of healthcare provider and with appropriate personal glucose monitoring, intermittent fasting can be safely undertaken in people with diabetes.